Hey everyone, this is Dr. Kazi, and in the next few series of videos, we're going to learn everything about the anatomy of the upper limb. Now, what is upper limb? Upper limb is your upper extremity of your body. It is also known as the upper appendages or the forelimbs. Now, have a look at this diagram. The osteology is the study of formation of bones. So before studying the anatomy, you should know the osteology of each and every bone in the upper limb. The skeleton consists of 206 bones. The upper limb will contain 32 bones, starting with the clavicle, the scapula, which is behind these ribs, your humerus, radius, and the ulna of your forearm, the carpals, the metacarpal, and the phalanges of your hand and wrist. Now, have a look at this diagram. The upper limb is generally divided into 6 regions: your shoulder, your arm, your forearm, the cubital fossa, which is between the arm and the forearm, really important according to the clinical point of view, your wrist, and the hands. This upper limb or the upper appendage will include 32 bones. Now let's study each bone one by one. Let's start with the clavicle. If you look anteriorly, the clavicle will look something like this. This is the superior view and this is the inferior view of the clavicle. Now, the clavicle is forming 2 important joints, one with the sternum bone and the other with the scapula bone. Have a look. The one end of the clavicle is forming the joint with the manubrium of the chest bone. So this end of the clavicle, which is forming the joint with the sternum, is known as the sternal end, which I have shown with the blue color. The other end of the clavicle is forming the joint with the acromion process of the scapula bone. So this end will known as the acromion end. So in general, the scapula will have 2 ends, the acromion end and the clavicular end, the acromion and the sternal end. There is an important tubercle which is known as the conoid tubercle. It is the attachment site of the conoid ligament. The tubercle is the rounded elevation on the bones due to the attachment or the pulling of the muscles. Now, this is the anterior view of the scapula, and if you turn this scapula like this, you get the posterior view. Remember, this is the anterior view of the left scapula bone. The scapula is between the 2nd and the 7th rib. So if we have the 2nd rib somewhere right here, the 7th rib will be at its inferior border. The scapula will have surfaces, borders, angles, and the notches. So let's discuss one by one. On the lateral side, we have the lateral border. The end, which is medially, so it will have the medial border. Superiorly, we have, yes, the superior border. Now, if we look posteriorly, we have 2 important fossas which are formed by this red colored acromion process. The fossa which is above the acromion process is known as the supraspinous fossa, and this fossa which is behind this acromion process is the infraspinous fossa. Now these fossa will contain muscle. The supraspinous fossa will contain the supraspinatus muscle, and the infraspinous fossa will contain the infraspinatus muscle. Now have a look at the angles. This is the inferior angle of the scapula and this is the superior angle of the scapula. The inferior angle and the superior angle. And this fossa which is present on the anterior side is the subscapular fossa, and it will contain the subscapularis muscle. Now, this is the posterior side, and if you turn this like this, now you will see at the medial side of the scapular bone, it has two important tubercles, the supraglenoid tubercle and the infraglenoid tubercle. Between these tubercle you have the glenoid cavity. Now this glenoid cavity will form the shoulder joint with the humerus bone of your arm. So we have the glenoid cavity in the center, and above it we have the supraglenoid tubercle, and below it we have the infraglenoid tubercle. There is an important notch which is known as the spinoglenoid notch, this one which I have shown with the red color, and through this notch we have the nerve passing which will connect the supraspinous fossa with the infraspinous fossa. This is all about the anatomy of the upper limb. In the next video we will discuss about the anatomy, the osteology of your arm, which include the humerus bone, and the forearm, which includes the radius and the ulna. Please do like, share and subscribe, and I will see you in the next video.